Health is a basic human right, yet many people struggle to access care due to limited funds and poor infrastructure. This lack of resources often drives people to rely on witchcraft and herbal remedies. Expectant mothers, unable to access proper hospital care, turn to traditional birth attendants.
Specifically for this community of ours, we still have mothers, despite the fact that the facilities are available. We have government facilities around which are able to handle deliveries. We have this facility around this community which is able to handle deliveries. But then we still have certain patients and mothers who have poor health-seeking behaviors, and you find that they still go to traditional birth attendants for deliveries.
Dr. Eletu Ernest Daniel of Project Orphanage Medical Center Zirobwe says these practices endanger both mother and child.
You find that a mother goes into a complicated case without them identifying, and by the time they think of seeking specialized care from a hospital, the condition is really so worse. We have received cases of severe fetal distress. We have received cases of ruptured uterus. We have received cases of obstructed labor. And we have also received some mothers here who are already dead. The mother has bled out, and by the time they reach here, they are already dead.
The non-government organization set up the Nampoge facility in Kayunga to save lives.
But as we continued operating, that was in 2018, more need kept on arising. Like mothers would come, they would want to give birth, but we didn't have room. So that's when we built the maternity wing called the Miracle Birthing Center. So it has been there helping mothers to receive antenatal, but we also give them mother's kit, and then that was a normal delivery. Okay, so time came up, and there was also need for C-section because mothers could not afford to push the baby normal, so we had to start that. But
it includes a modern birthing center and it treats various diseases, registering hundreds annually.
For medical cases in a month, range between 30 to 50, and those are mild to severe cases. And then for maternity, we do between 20 to 30 mothers per month. That is both for normal and cesarean section. And then for antenatal care, we can go up to 100 mothers per month seeking antenatal care services.
Directors Sarah and George Sanga say they also support vulnerable girls, oppressed children, and the homeless.
In our medical center alone, in a year, we see around 2,000 plus patients. That is including children, mothers, men, elderly, over 2,000 plus. That's what I can think. Yeah, so, but of course, the medical center is not the only thing that is in this place. So as we continue working with the district, of course, the need started arising. You'd hear cases, a child has been molested, defiled, then others were like tortured by their own parents.
And basically, tutunulidde abaana okusoma kw'abaana, providing education for the children, for the vulnerable children. Bwe twatandika twalina vision y'okuyamba abaana nti tubasomese abatalina buyambi bafune okusoma bamaleko. Naye nga bw'omanyi nti as you go, when you start up something, along the way obeerako ne byolaba nti tewali luguudo luli straight. Nti mu kutandika okwo twatandika naye ne tulaba nti walingawo other needs. Namwe community yaffe mugiraba. Abakyala balinga bazaalira nga tebamanyi bya health facilities, bazaalira ka bitooke nga n'ebya scan bo tebakola ki, tebabiwulirangako. Kale ne wajjawo need y'eddwaliro nga malaria ye ng'abantu bagamba bafiira mu mayumba, abaana bafiira mu mayumba lwa malaria. Facilities ezibali okumpi nga ziri wala, gwe gye wandiise ngeri okumpi ng'otambula miles eziwera. So kati there was a need for that. Netutandika ne Project Orphanage Medical Center.
Beneficiaries commended the NGO for the tremendous work.
Era nze nebaze ekitongole kya orphanage kinkoledde ebirungi bingi. Kyantwalako abaana basatu nga sina buyambi. Basatu bennina abali mu kitongole. Bwe bamaliriza ekyo agenda okulaba nga banteekerawo ekizimbe ekyo kye mulaba.
Kino kiba kifo kino singa nafadda kuba nalwala prostate nga tibali wano singa nafadda kuba nagenda ebombo bintu byalema naye kati bano basobodde kumpa bujjanjabi bwonna mu ngeri yonna.
Bansomeseza ne baza n'obulamu bwange bujja.
Over 400 underprivileged children are in their care. Despite progress since 2017, challenges remain, prompting the construction of a larger hospital.
Tulayinza okukubira n'agamba omwana wange bamukutte. Oba olina kubya bannange wano waliwo omwana gwe baakoze eki gwe baakutte. Kati bweweekanga nti otuuka nga omuntu eyakutte asobola okubeera ku run nene mumunoonya. Bwe mumufuna ne mumutwala ne mukwasa ab'obuyinza. Kati ogwo omusango olede gubanga nti olw'okuba tuli ddoboozi lya mwana gwe baakutte mmwe muwoza ku lw'omwana okitegeera naye nga muwoza ne famire eyakoze eki eyakutte oba n'omuntu eyakutte.
Amwaiva Njuko for UBC.